In this lesson, we're going to talk about alcohol problems. We've discussed drug use and various types of drugs and their effects, including heroin, so now we're going to focus on alcohol. In this lesson, we are going to be able to describe the use of alcohol in the United States, explain the concept of standard drinks and their relationship with blood alcohol level. You should be able to describe the effects of alcohol and list 6 risk factors related to high-risk drinking. Alcohol causes significant harmful effects in developed as well as developing countries. It's among the top 12 leading avoidable risk factors for disease, and it's becoming increasingly problematic. Communities have the opportunity to reduce morbidity and mortality if they're able to reduce the overall consumption of alcohol. Prevalence rates are higher in urban and more populated areas than the rural ones. And episodic drinking is about the same in both of those areas, but lifetime prevalence of AUD was somewhat lower for urban residents, which is about 29.6%, than for the rural residents, which is about 33%. And this could be due to access to treatment. The U.S. is not excluded from problems associated with alcohol, and we're going to discuss how to prevent those problems during this session. Alcohol addiction or alcoholism and abuse is higher than the prevalence of alcoholism in each area. The prevalence of alcoholism is higher in cities than in the rural mountainous areas. And this is probably because drinking rates in the community are higher in cities. Social problems associated with excessive alcohol consumption are really common, and these problems typically relate to intoxication or regular use. Of particular concern are the higher rates of traffic accidents associated with drinking. 85.6% of people who are 18 and older have drank alcohol in their lifetime, and 14.5 million people have an AUD. And 25.8% of those people have engaged in binge drinking in the last month. And we can see that up to 80% of drinkers report fighting after social drinking. And the ASAM, or the American Society of Addiction Medicine, notes that between 28 to 43% of violent injuries and 47% of homicides, alcohol has been estimated to be involved. And there are studies that have shown that substance abuse has been found to reoccur in 40 to 60% of intimate partner violence incidents. And in the US, 35% of victims who were able to report on their attacker believed that they had been drinking prior to the offense. Up to 18% of drinkers report family breakups. 31% of the drinkers report losing their jobs. 50% of those who are drinking get into traffic accidents. And alcohol-impaired crash and fatalities account for 28% of all crash fatalities. More than 575,000 arrests for driving under the influence of alcohol or drug or narcotics, and only 1% of the 111 million self-reported episodes of alcohol-impaired driving among the U.S. adults are arrested each year. That is an outstanding statistic. 1%. Only 1% of them. And I read somewhere a long time ago that on average people drive about 80 times drunk before they get caught. So they're convincing themselves that it's okay to keep doing it. So let's take a look at the glasses on this slide and think about what it is that you're seeing here. There's different glasses for various alcoholic drinks, and these glasses hold different volumes. So we have 12 ounces for a regular beer, 8 to 9 ounces for malt liquor, 5 ounces for table wine, and only 1.5 ounces of 80 proof liquor. So when we're asking clients how many standard drinks did you have in any one sitting, they're liable to say 1 or 2, but their 1 or 2 is actually a 24-ounce can of beer. So that would actually be 2 in 1 cup or 1 can. And so they're having 4 beers if they have just 2 of those tall boys. So it's important for us to ascertain what kind of cup are they drinking out of. Each one of these is one standard drink. And although the concentration of alcohol in each drink is different, each of these glasses contains approximately 10 grams of pure alcohol because the volume of the drink is adjusted to give about the same amount of alcohol. And we see that the wine glass has only 100 milliliters of wine in it, which is much less than the amount of wine that someone might pour into the glass. And also notice the spirits, which maybe could be whiskey, for instance, is only 30 milliliters. So a standard drink raises the blood alcohol concentration, which is your BAC, by approximately 0.02 grams percent-wise for men and 0.03% grams for women. So the alcohol molecule is small and it's highly water soluble. Its rate of absorption depends on the stomach emptying time. So the rate of alcohol absorption is slow in the stomach and faster in the small intestine. So food in the stomach delays emptying and hence will slow the alcohol absorption and lower the peak BAC result. The pharmacokinetics of alcohol are that they are rapidly absorbed into the blood by the stomach, about 20%, and in the small intestine, about 80%. And it's metabolized by the liver, 95 to 99% alcohol, acetaldehyde, acetic acid, and H2O, and CO2. So the major metabolic pathway for alcohol is ushered by an enzyme called alcohol dehydrogenase. And this has a genetic variation among human beings that results in variations in metabolism. And this variation is commonly seen in Asia, where about 50% of drinkers in Asia actually lack this enzyme. And so the defect causes a buildup in the acetaldehyde, and it causes the face to become flushed. They have a rapid heartbeat, increased body temperature. The skin literally radiates heat. And symptoms also will include nausea, headaches, and lightheadedness. So this is distributed into the body fluids. It's not distributed into the fat. So one standard drink is going to raise the BAC, but like I said, by 0.02 gram percent for men and 0.03 gram percent for women. And it takes about 1 hour to remove one standard drink. So that's about an average rate of 7.5 grams an hour. And we can do a range there from like 4 to 12 grams for every hour. So the 2 tables in this slide are going to describe the risk of harm due to alcohol consumption in terms of immediate and long-term effects. So the table on the left is going to show the risk of harm due to immediate effects of consuming alcohol. So for males and females, there's this relatively low risk with consumption for up to 4 drinks on a single occasion. And once this limit is exceeded, the risk of injury is no longer considered low. The table on the right is going to show the risk of harm due to a lifetime of alcohol consumption on any given day. So in essence, the cumulative effects of drinking alcohol throughout one's life. And this is going to be based on calculations of the cumulative risk of alcohol-related chronic disease or injury over a person's lifetime. So this risk is considered low if 0 to 2 drinks are consumed on a given day. And as the number of drinks on a given day exceeds 2, the risk is no longer considered low. So the level of acceptable risk listed in these guidelines is based on a risk of dying from an alcohol-related disease or injury. And the chances of this happening are about 1 in 100%, or 1 death for every 100 people. In other words, 1 in 100 deaths are predicted for a lifetime consumption level above 2 standard drinks per day. And other factors are going to increase the alcohol-related harm. And these are going to include situations where alcohol consumption may endanger someone's life. So, for example, drinking and driving or operating heavy machinery or things like that. So for healthy men and women, drinking more than 4 standard drinks on any single occasion is going to significantly increase the risk of alcohol-related injury arising on that occasion. So the safest option for children and young people under the age of 18 is just to avoid drinking alcohol entirely. And drinking alcohol during pregnancy is going to raise the risk of birth defects. And while it's clear that women have this greater physiological vulnerability than men, there are other gender differences related to risk-taking. And men are more likely than women to engage in risky behavior, especially when they're consuming alcohol. And this is generally reflected in alcohol-related injury data. And at comparatively low levels of consumption, there's really no apparent gender differences. But as the consumption levels are increasing, the gender differences become way more obvious. So here we can see that there are several levels of intoxication as far as blood alcohol content goes. And we can see that there are, the lower the blood alcohol content, the more mild the impairment. And as you go up in blood alcohol content, that impairment is going to become more and more severe until it gets to life-threatening. So when you are mildly impaired, you're going to have mild speech impairment, memory issues, coordination issues, attention and balance impairments, and it's going to have some perceived beneficial effects like relaxation and sleepiness. And that's going to be from the 0.0 to the 0.05%. Then as it's increasing to the 0.06 to the 0.15%, you're going to have increased impairment, obviously. So the perceived beneficial effects give way to increasing intoxication. Speech, memory, coordination, attention, balance, all of that's going to be further impaired. And the significant impairments are in the person's driving skills. And you have an increased risk in aggression in some people at this particular BAC. Then as it's moving up to the 0.16 to the 0.3%, then we have severe impairment. So speech, memory, coordination, attention, reaction time, balance is significantly impaired, all driving related skills, judgment, and decision making, they're dangerously impaired. Vomiting and other signs of alcohol poisoning are common at this particular level. And then anything over 0.31% and going into the 0.45%, this is life-threatening. You have a loss of consciousness, danger of life-threatening alcohol poisoning, significant risk of death in most drinkers due to suppression of vital life functioning at this point. So it's important for us to understand that as the blood alcohol content is going up, the impairment level is also going up. And as we can see here, the effects of alcohol intoxication, note that these numbers are not precise, and the actual effects of the BAC are going to vary from person to person. And remember, the experience of a drug is an interaction between the drug and the individual and the environment. So the alcohol, or the effect that alcohol is going to have on the brain, is not only based on how much alcohol you drink, but also some individual factors like tolerance, environmental factors like where you're drinking. So if you're not used to drinking, a low blood alcohol concentration can still make you feel quite intoxicated. And certain factors are going to predispose a person to heavy, regular alcohol consumption and alcoholism. And they include a variety of environmental and genetic factors. And there's a well-documented evidence that a family predisposition to alcoholism is going to increase your predisposition to alcoholism. So you have 8 times the risk of becoming an alcoholic if a close relative is an alcoholic. But that doesn't mean that it's inevitable. It is a lifestyle disease, so we can choose not to drink and we won't become addicted to it. Some of the studies have said that if you have a parent, you are 50% more likely to develop an addiction if the parent is also suffering from addiction. And if it's a grandparent, you're 25% more likely to develop addiction if your grandparent was dealing with addiction as well. And binge drinking is regular drinking to the point of heavy intoxication. So for men, this may be more than 6 standard drinks on any one single occasion. And there are several risks that come from this type of drinking. So this particular slide is showing some of the things that binge drinking can lead to. So you can do it in the chat box below this lesson, but I want you to kind of discuss with the other classmates what are some other things that you think might happen from binge drinking. And we can see that there's an increase in risk taking, poor judgment, poor decision making. You can have accidents or misadventures, increased risky sexual behaviors, increased violence, suicide, and things like that. But I want you guys to think about what else can happen because of binge drinking. And young people, and I'm talking about up to 18 years old, and young adults who are like 19 to 25 years old, are particularly vulnerable to the risk of alcohol consumption. And young people's patterns and levels of drinking are going to place them at significantly higher risk of harm compared with the community in general. So the reasons for increased risk are going to include smaller physical size, fewer social controls, their friends are condoning the intoxicated behavior, and there's a risk of overdose to lack of tolerance. And there's multiple potential harms that can occur as a consequence of heavy drinking. And commonly these harms are a direct result of the problems from intoxication, but less commonly there are also some other problems that are associated with regular use or alcoholism. So a blackout is going to happen when a person is so intoxicated that they can't remember what they did or said while they were drinking. They seem like they're in control of themselves and awake, but then later on they have no memory whatsoever of what happened during that time period. And women are more susceptible to the effects of alcohol because they're smaller in size than men. They have a lower blood volume. They have smaller body water, like water to fat ratio. And they have a reduced ADH activity in their stomachs. So it's a reduced metabolism of alcohol. And so that's going to result in an increased risk of related harms from intoxication like assault, injury, unwanted sexual behaviors, and also earlier development of organ damage. And because they have a higher blood alcohol concentration after drinking that same quantity as men, they have an increased likelihood of organ damage. That alcohol dehydrogenase, the levels in the stomach of females are only at 50% of those that are in the male stomachs. So that's going to result in a slower alcohol metabolism in the stomach before the alcohol is even absorbed. And the higher the alcohol-related risks in women are, it's going to be related to the higher BAC in women as compared to men when they consume equal volumes. And the alcohol consumption during pregnancy can also be harmful to the unborn child. So in summary, alcohol is a legal drug, but it can still cause harm. And one standard drink contains roughly about 10 grams of pure alcohol. It's going to raise the blood alcohol level about 0.02 to 0.03 gram percent, and 1 hour is required to metabolize it completely. And women and young people are especially vulnerable to the effects of alcohol, and there are some recognized risk factors that predispose a person to alcoholism. If you have any questions, please feel free to put it in the chat box below this lesson inside of your course.